So I'm very proud to be standing here representing Adara tonight and introducing you to these incredible teams who are leading the work. So with that, I'm going to hand over to you, to our wonderful CEO, Madeline Vaughan.
Thanks so much, Odette. And I just want to echo Odette's welcome. Thank you all so much for joining us tonight. And we've got a really great series of speakers who are going to share a little more information about the current crisis in Nepal. Before we get started, I thought I'd just go over some logistics and housekeeping for today. The first, you might have just heard a little voiceover saying that we're recording the webinar. This is so that anyone who can't attend this evening can catch up on a recording later on. And all attendees today will also receive a link to the recording, so feel free to share it with anyone you think might be interested. So today you're going to hear from our teams in Nepal who are working incredibly hard through a very devastating second wave of COVID-19 that is currently overwhelming the country. First, we'll have some updates from the team, and then we'll open up for Q&A at the end. And thank you to everyone who has shared questions with us already. We'll get through as many questions as we can tonight. I'd ask you to please bear with us if there's any challenging internet issues or connection issues with our colleagues in Nepal. It happens from time to time that power goes out or internet fails, but fingers crossed we have a smooth webinar tonight. So for the Q&A at the end, there'll be a few functionalities in Zoom that we'll be using. You'll see at the bottom of your screen, there's a Q&A button where you're able to submit any questions you would like to ask. If you submit your question in the Q&A box, you can either raise your hand if you want to ask your question live, or you can leave the question, type the question in, and I will pose it for you. If you choose to raise your hand, our wonderful team working in the background will unmute you and we'll let you ask your question. So we'll be able to hear you ask it, but there's no pressure to ask it live if you'd rather just submit it. There's also no need to wait until the Q&A session to start sending questions through. Feel free at any point throughout the webinar to start submitting as soon as you have a question. Other key features we have is the chat feature, and feel free to communicate with us through the chat and tell us what you're thinking and send some love. I already saw some lovely messages coming through. And to get started, it would be lovely if everyone could share where they're tuning in from in the chat box. We'd love to see which countries around the world are represented here tonight. And so with all of those logistics aside, it's time to get started. And it is my great pleasure to introduce you to our panelists today. Today we're joined by some of my amazing colleagues, Mr. Prahlad Dakal and Mr. Angjuk Lama, as well as a Nepali public health expert, Dr. Sagar Podel. Prahlad is our Nepal country director and leads all of our work in Nepal. And at the moment, he is working around the clock to respond to this second wave of COVID. He is an incredible leader. And I feel like for me personally, these past months have been a masterclass in leadership in crisis and just the innovation in response. And I am so proud to work with Prahlad. As Odette mentioned, he's led us through many crises in the past, including the devastating earthquake in 2015. And we are really fortunate to have him leading our team. Angjuk Lama is our Nepal program manager who oversees all our Nepal programs, especially those up in very remote Humla district. Angjuk is a Humli man and a Fulbright scholar, and he knows the challenges and needs of remote communities like only a local can. And I'm so happy that he can share with us some of those challenges tonight. Lastly, we're joined by Dr. Sagar, who is a physician and a public health expert who completed his Master's in Medicine in the most prestigious medical school in Southeast Asia. He's been connected with Adara for many years, including spending more than a month and a half trekking through remote Humla delivering health services as part of Adara's mobile medical camp. He's a very deep knowledge of the current COVID-19 crisis and is working with the World Health Organization in Nepal at the moment. And we're really very grateful that he's joined us for today's briefing. So please join me in welcoming our panel. To get us started, I'm going to lead with a question for Dr. Sagar. Would you be able to provide us with an overview of the current crisis, how it started, and what the greatest challenges are currently facing Nepal? You're currently on mute, Dr. Padel. Thank you.
Hello, namaskar everyone. Nice to be connected with you all. Thank you, organizer ADRA Group, for giving me the opportunity to share my share few things about COVID-19 and be connected with you all. And I was already connected with ADRA Nepal previously. I worked in ADRA Nepal, as you already mentioned. I worked for 1.5 months.
This is the internet connection issues that I thought we might experience. We might just see if Dr. Padel reconnects, and if not, we might come back to him, and I might turn to Prahlad.
COVID-19 in Nepal, and more than 7,500 deaths has occurred in Nepal because of COVID-19. And coming to test positivity rate, in Nepal till now is 18%. That means that out of 100 people who are tested, 18 of them are positive. If we compare it from the starting of COVID-19 since early 2020 to till now, case positivity is 18%. And when we compare the in second wave, if we compare test positivity till now since 1 month, test positivity rate is around 40%. That means out of 100 people tested, 40% are positive. That means the test positivity is highly in Nepal in last 1 month period. This is a very alarming situation. The virus, the variant which is circulating now is highly infectious, highly contagious, rapidly spreading than previous one. So test positivity might have increased in Nepal. As in India also it is increasing. In Nepal also follows the same because of open border with India. And coming to the Humla data of Humla, test positivity rate in Humla from beginning of COVID-19 to till date is 17%. Out of 100% tested, 17 were positive in Humla. If we compare from early of this COVID. And now, if we compare the last 1 month data in Humla, it is also around 40% in Humla also. It is comparable to Nepali average. In last 24 hours, total positive were 341 out of 1,000, almost 1,000 tested. That means case positivity rate last 24 hours is 34% in Humla. That means that in second wave, we are declining in Humla also. That are the main data which I want to present. In case I would like to highlight on case fatality rate. Case fatality rate means out of 100 people who are posted, how many die? That means in national average till now, case fatality rate of Nepal is 1.3. That means out of 100 tested positive, 1.3 have lost their life. But in Humla, it is quite low. It is quite good news for only that out 1.04% is case fatality rate of Humla. That means out of 100 people tested positive, 1.04 were only lost their life compared to Nepal. It is quite low compared to Nepal. And total death in Humla till now is 251. We have lost around 251, more than 251 people in Humla till now, and more than 7,500 in case of Nepal. Coming to the challenges of this COVID-19, first main challenge is the new variant, which is very highly contagious and rapidly spreading. That is why test positivity rate is high. Another is community transmission. In previous wave, there was doubtful that whether there was community transmission or not. This time there is a clear picture that there is community transmission of this COVID-19. And regarding public health and social measure, as is a major part in this major part, due to which we have a large number of rise of cases. The way to get prevented as a physician and public health expert, I would like to highlight that to be protected from COVID-19, best measure is public health and social measure. But we lack in this in last few months. We lack in this. Many marriage ceremony were there, many gathering were there, and people stopped wearing masks. So case has rise a lot, and there is open border with India. That also the people coming from India, they were not placed in quarantine properly. They were not tested properly. So they brought infection to the country, and infection now has increased from town to village, remote part of villages also. This public health and social health measure has been a common problem. Next problem is now, which challenges we are facing is hospital and human resources. Hospital are already packed. People are not getting bed in hospital, no ICU, no ventilator. They are already preoccupied. So we have, in case of resources also, we are back in case of resources. Due to surge of COVID-19 second wave, where many people suffered because of lack of bed in hospital, ICU, and this test. And oxygen has become another challenge in this situation. Oxygen in COVID-19, people there is a saturation falls down. When saturation falls down, main step of treatment is oxygen. But we're limited of oxygen because we don't have oxygen plant in every part of the country. So we have to carry cylinders. Many hospitals have to carry cylinder and go for another places to fill this cylinder. So there was a gap and cases were high. This time the cases were severe cases, so they need high flow of oxygen and longer hospital stay. So new patients were not getting oxygen and get their turn to be admitted in hospital. That is, oxygen is also another problem now. And other thing is that because of because of using of medicines like steroid or unjustified use of antibiotics, many people are suffering from chronic illness like diabetes mellitus, and few cases of mucormycosis, that is black fungus, has been reported in some part of Nepal. If it goes like this, it may be expected to go in many places of Nepal also. Still, we are low cases are there, but if condition goes like this, if there is no justiciable use of antibiotic, steroid, it may black fungus can be another devastating event for Nepalese also. And other problem, post-COVID symptom. Many people are now those who are discharged from the hospital. They have completed their isolation period, but still they are also facing post-COVID symptoms like weakness, the vertigo, dizziness, body pain, and rise of blood sugar, hypertension. Again, they are post-COVID people also. They are again going to hospital and get admitted. Even we have seen many cases of myocardial infarction, heart attack, post-COVID also. So post-COVID symptom has been another main concern for us. Now I'd like to highlight another social stigma. In Nepal also, there is a big social stigma, which we should be aware of this. The house in which there is COVID patient, that has been those house has been taken as a stigma to the people. They do not like to go near to that house. They don't like to talk to that house, and they are not getting the people are not getting basic services which is their basic right. So that is stigma is also, we should also focus on removing social stigma. The way to remove social stigma is awareness only. There is no other role. So we should make people aware that this is a disease. We should help other people being protected ourselves. For example, one can protect their neighbor, infected neighbors by helping them to buy medicine, by helping them to get their basic daily goods, or by helping them to contact with hospital, ambulances. But people are not doing so. That is also another concern for us. And I'm talking, these are the main problem which I as a whole in Nepal. As a part of Himla, as I have seen worked in Humla, I would like to highlight few things. There is a lack of transportation in Humla. I think still the headquarters is not connected by road, fully functional road is not there, I think. So one has to carry by lift by air, and people are economic condition. All of the people cannot lift their patient by heli, cannot do heli lift or airplane lift to their patient. Lack of transport is very big problem for Humla. And no hospital setting, no big hospital or ICU or well-managed ventilator setting are there in Humla, which is challenging to them. And very poor and vulnerable people. The poor and vulnerable people are there. They cannot afford medicines, or they cannot afford testing also. I think now testing has become free in major part. But the poor people, that is also quite a drawback for Humla also. And one main issue which I see in Humla, I would like to emphasize our group is that in third wave, it is expected that children may be affected. Those who children will be affected, malnourished children. If children are affected, those children with chronic disease and malnourished children will be affected most.
Thank you.
Children with malnutrition and malnourished. So Humla can be a risk, another risk if third wave comes and affect children in the future.
Thank you, Dr. Wow, thank you so much for that really comprehensive outline and of really highlighting some of those challenges that Nepal is facing and the unique challenges that Humla is facing. And Prahlad, as you hear about all this myriad of challenges around, access to oxygen and hospitals being overloaded and potentially children being impacted, I'm curious to hear from you how you knew where to start in how to respond to the crisis. How did Adara go about responding to this second wave?
Thank you, Maddie. I'll go quickly. Like, the responding COVID, we started from the first wave, which is like, March, last year, March in last year. So we started from there. So our response was, we got prepared. We had a proper plan in the place. Actually, we together with our, all global team, global health team and Nepal team, we together put a plan in a place. So we followed the plan, and first wave was pretty much kind of what do you call, like, it was not that devastating like this wave. So first wave, we did a lot of work with our community. We prepared our community, more of kind of prevention work we did in the community. A lot of prevention work, preparing community to fight, and health post. We work with the prepare them to fight with. So that was a priority for the first year. And then this year, the size of the damage or what's called the level of pandemic is very rampant, and death, and then spread rate, everything is very rampant in all the community, in the town and in the villages as well. So we had a plan. A is like ongoing, doing all COVID work in ongoing projects. Like we have a health and education project. We do COVID, when COVID was like a kind of cross-cutting for all our work. That was plan A. And the plan B is like this is something not, we have to activate our plan B. That means we have to focus everything in, COVID response. Not only awareness, also responding, making our health system prepared. Make sure that they have all essential medicine, essential gears for the health workers to respond COVID. So we till now, from last year, now our focus is to make our health personnel in our working areas ready to deal with that, with their proper gear, proper medicine, and proper equipments in the place. So that's our plan B. And we now saying like a plan B plus is means, we also working with the government, we working with the state here. So that means we are also guided by their need as well. And they also guide us to respond COVID. So we started, like rightly Dr. Sagar pointed out, lots of cases are coming in Nepal from, because of open border. So we working with the, security personnel to manage the border. We cannot do, all borders, other organizations, we divided. In Nepalganj, we took responsibility because Nepalganj is kind of, gateway for Karnali or Humla. So we thought like we are more better placed to work in Nepalganj with the security personnel and UNICEF. We together, trying to manage the border. We're working with the health personnel. We started a safe home for the nurses, so that nurse can stay safe. Stigma and taboos, like if you are working in a quarantine, if you are working in a ICU or COVID hospital, the nurse, they cannot go easily home and stay there with their family. For themselves and also in the society, there is a stigma that people in the first wave that the nurses were not allowed to go to their rented apartments because of their neighbors, and everybody was pretty much kind of not poor. They had a huge stigma on that. So we started like a residence for the nurse so that they can stay nicely and in a very cozy environment and work. And we thought like it is equally important like oxygen. And it's not that we're not working on oxygen. We are also trying our best to address the oxygen need. But Humla, you cannot carry the bottled oxygen. So what you have to do is you have to rely on oxygen concentrate, high flow oxygen concentrators. So we are trying, we provided some, and we are trying to have more oxygen concentrators for Humla and other part of the country where we were working. So yes, our plan B plus is activated, and we are massively working with the security force, UNICEF, and our own team in the ground. And media also, I forgot to mention a little bit. We're also using media. Like we are teaching kids from the radio, but at the same time, we're using media to convey a positive message or essential or important message from the radio to the public. So we're trying, we're trying all avenues that is accessible to us.
Thanks, Prahlad. And Angjuk, just to pick up on what Prahlad's talking about in terms of the response and some of the challenges that are being faced, can you talk to us about the impact of this crisis on remote communities like Humla, and how the challenges are different, and how some of the essential services like education and child protection services might also have been disrupted by the crisis?
So absolutely, just to add add on what Prahlad was saying. I mean, I'm from Humla, and Humla is one of the most remote regions in whole of Nepal. So still with no road access, the only way to really take all these essential materials or health service, it's by plane. So there are so many challenges. I mean, the primary challenges right from the COVID. I mean, some of the responses we've been trying to do is to work with the Nepal government to really, the existing hospital and the isolation center to really equip them with the medical equipments or essential medicines. So that's one part. But once you go out in the remote villages, so many villages that we work with, this basically you don't have good health services, and especially with all these COVID-19 and the strict lockdown in places, schools are shut down. Helpers are not getting the essential support from the government. So I think to really fill those gaps, and we really want to make sure those health services are functioning smoothly, supporting them with essential medicines, PPE they need, the health protocols that they need to follow. And on the education side, when schools are closed, their learnings are disrupted. So one of the we have very limited options to really support these things. So we are launching radio classes, we're in the radio class, distributing them. We call it home learning kits. Some of the pre-recorded audio devices, books, exercise books, and so that kids' learnings are not really disrupted. And so wherever, and there are so many villages, they are not even access to radio. So one of the ways for us to really engage them into learning is to really home learning kits, or through the loudspeakers or pre-recorded learning devices. And the secondary impact of this COVID is huge. I mean, we've been working there over 23 years now, and it took us so long and so many efforts to really bring the enrollment of the kids to school. At least in our working areas, we have 100% enrollments, and we have we've put in so much effort to do the girls' education and to really bring down the dropout rates, the child marriage, or the child trafficking, Humla, and the Gangfede, the way we work, we have a huge child protecting issues. So all those years that we've been really working hard to make sure we come to this level. We have more girls in our school than boys right now. The retention rate is much higher. But with this pandemic, with this COVID, all these achievements, all these momentum are under threat right now. And so our response is really, of course, the direct, we really try to raise awareness in the community. And again, being remote area, I mean, a lot of villagers are not really have good access to all these information. So there are so many rumors, myths, and misinformation about the COVID. So we are really trying to raise awareness, to really to dispel those misinformation. So on a food, again, Humla, it's a very food insecure region, and more than 95% of the people living in that region, they just is not they based on food subsistence-based farming, but the food is simply not enough for them. So they heavily depend on World Food Program for the government subsidized rice. So its food insecurity is a huge concern, which will I think which will really impact the health of the nutrition of the young children, the pregnant women and the lactating women. So one of the some of the to really reduce those, and what we are trying to do, work with them to build greenhouses, try to make best use of their available resources, so that they can get through this crisis and really reduce the hunger crisis in the days to come. So there are so many. I mean, the secondary impact is it's just unimaginable. And I think, like, Nepal having a much higher cases and the deaths compared to India, but India has been a sort of a global attention, and Nepal is falling behind the shadow. Same thing with Humla being very remote, and there are so many other regions like Humla. Those are the ones really sort of falling behind the shadows. All the major public hospitals or private hospitals or schools are in the cities, and so government attention is in the big cities. They're diverting the resources into cities, and these rural areas are being sort of left out. And so, I think a lot of all these mass testings are not really going forward that we wish. And, when you have all these infrastructure gaps and all these testings lacking, this can really invite a disaster in the future.
Thank you, Angjuk. Prahlad, I'm interested also to hear a little bit more about it, the response efforts that have been underway. And I feel like it's a bit of an understatement to say that you've been busy, you and Angjuk, in the past few weeks. I think, I don't know if you are sleeping at all, either of you. I know you're working around the clock. But I was curious if you could highlight some of the key achievements from this time and what the future might hold.
Thank you, Maddie. I'll just highlight the major thing. I think three things. One is, first thing, we wanted to make sure that the health system are functional in the villages where we work, and they are functional. And thanks to our Humla team that they transported, airlifted. Actually, it's transported with airlifted. All the necessary medicines, PPEs for the health workers, everything on time. They airlifted and took it on the mules and sent it to the villages, all the service centers, and they are functional. And that's one thing we wanted to make sure during this pandemic, and it is going on. Second thing we started is border management, as I highlighted. So every day 1,500 people are entering in the border checkpoint where we are working with the armed police force in Nepal. So we thought it's a very important piece of work. So every day in average, 1,500 people are coming. So what we are doing is that, all the 1,500 people, they go through the testing, they go through the scanning, testing, and also we provide everyone mask, everyone drinking water, and those who are positive, we provide them health kit. Ladies, that we provide them, dignified menstrual kit. So more than that, actually, and then they will be transported by the security force to their nearby quarantine center if they are positive. So that's the one big piece of work going on, and since last, it's a month. And another big piece is we working with the nurse, and we have provided them a very cozy residence in Kathmandu, and we are targeting 100 nurses, and we are encouraging other organizations to do the same, because we are sharing it so that many nurses or many health workers, they get a similar sort of facility. For future, I just trying to keep it short. For future, I think there are two things pretty important. One is vaccine. So I think we are already engaged in a vaccine discourse within the country with WHO, UNICEF, all those organizations. We are participating, how we can make sure that, people access the vaccine. Those who are, out of the, access, what you call, access nexus, how we can make sure that, people in Humla, people in a much remote part of the country, they access the vaccine, and poor people access the vaccine. So that's another big future work, I think, more on lobbying advocacy, but at the same time, also resourcing if needed, resourcing government, resourcing the district or local government where we work to have vaccine for their people. And second one is that if you recently look at Indian third wave already started in Maharashtra, Mumbai, and 8,000 kids are admitted in the hospital yesterday. So yesterday's data, around 8,000 kids. So that means third wave is much more kind of, it's a more like, targeting the kids, infecting the kids. So I think in Nepal, there is no preparation. And as Dr. Sagar said, in Homla, lots of stunted kids are there, stunted children are a huge number of 60% is stunted kids. So I think we have to be at least prepare the health system to help, to address this challenge that, COVID is targeting kids, and we are child friendly. We are, child organization, actually, women and children organizations. I think we have to be prepared for this third wave on right time, so that it's not like second wave that we just are not prepared. We're not thinking that we will have a oxygen crisis of this level. So I think for third wave, we have to aware all the involved stakeholders and government, be ready on time, and keeping in mind that a huge number of kids can get infected. That's the future.
Yeah, thanks, Ballard. I think there's lots of wise words there. I want to pick up on one of the things that you just talked about, which is the need for vaccines. And I might get you and Dr. Sagar to talk about vaccines in Nepal. And in the lead up to the webinar, we received a lot of questions about vaccines. So can you tell us the current vaccine availability and the current vaccine situation in Nepal at the moment?
Dr. Sagar, you want to go, or me? I start, Maddie.
Yep, Dr. Sagar, please start, and then Ballard, if you have anything to add.
He is a WHO person, so he may have more information than I do.
Thank you so much. Regarding vaccination, almost more than 2%, 2.5%, almost 2.5% people are vaccinated in Nepal. And many of them have not completed the second dose of vaccination. The vaccine which we received through COVAX, Covishield vaccine, which we received through COVAX, that was supposed to 2 million vaccine was supposed to come, and we were supposed to give a second dose of vaccine to the people, but unfortunately that could not come. I don't know, that may be a reason, internal reason in India, that High Court of India ordered that this vaccine now, instead of the High Court of India ordered Serum Institute, which manufacturing Covishield, that instead of order that vaccine cannot be exported to other countries now. That's why our 2 million vaccine has been held up in India, which was already supposed to come. So we are not being able to vaccinate second dose to those who received first dose of Covishield. Now, Berosil Chinese vaccine, where people are already, vaccination process is going on regarding it, and we are receiving by vaccine from China. Very soon, few vaccines have arrived, and very soon new vaccines are also coming. And advocacy has been carried out through WHO and government of India, President of Nepal, and Foreign Minister, Prime Minister. Negotiation has been carried out with other countries like USA and Great Britain, United Kingdom. So we hope that many vaccines will come in the future, and we'll be able to vaccinate much of the Nepalese people. Main advantage for Nepal is the population is very low population, only 3 lakh population. Among them, if we are able to vaccinate to 60 to 70% of people, it is believed that, according to epidemiology theory, that if we are able to vaccinate 60 to 70% of the people, remaining 30-40% will be acquire herd immunity. So that our target should be to bring at least 1.5 crore of vaccine. If we are able to bring 1.5 crore of vaccine and vaccinate many people, we may enter in the stage of herd immunity. That will be beneficial of the country. Let's hope in the future. Thank you so much. That's over to you.
Thank you, Dr. Sagar. It's a worrying situation. I think a lot of other low and middle income countries are also worried about supply of vaccine, and it feels like that is a pathway out of a lot of the crisis. We'll be getting 60 to 70% of populations vaccinated. So pleased to hear that China is sending some vaccine, and hope that Nepal can access some more soon. Prahlad, as you'll know, Adara also works in Uganda, and we're seeing the rise of COVID in other low and middle income countries, and particularly in Africa right now, cases are beginning to rise. So do you have any advice around what other low and middle income countries could do in the short term to mitigate the effects of the pandemic, or any things that you wish you'd known beforehand, advice you'd like to share?
I think health infrastructure like oxygen or medicine, essential drugs. You can even run out of Citamol, like a fever tablet. That's a small thing, but oxygen crisis, actually, a huge oxygen producing country like India had a serious oxygen crisis. India has a huge like a liquid oxygen plants in the world. Despite that, they had a very, very hard time having oxygen, and lots of people died because of not having oxygen on time. So I think a better preparation. All the country, they can assess their situation. Don't underestimate that. We had a big mistake that many of us, that we thought like in Nepali has a more immune power than anybody else in the planet, and all this thing. We had a kind of what you call feeling that we had a best immune power, and Nepali people, because you grew up in a dust, COVID cannot kill you like that. So we underestimated in the first round, and first wave was like that, and it was natural to underestimate COVID like that in the first wave. Second wave taught us a lot. Actually, it's not that simple. It's not that we have the best immune, or immune can defeat like that. So I think one part, people can be prepared with the discipline. COVID discipline, that's what I say. More than protocol, it's a discipline. How you can be a discipline so that COVID doesn't catch you. Second is, for the policymaker, duty bearers, I would say, do proper assessment of your health service, proper assessment, so that, and be prepared for the worst case scenario. That's what I suggest.
Thank you, Prahlad. That's, I think, really good advice. Angjuk, I'm curious, we had a conversation earlier, Dr. Sagar raised the issue of stigma, and one of the questions that came through in the chat was around whether there's been any behaviour change or health campaigns since the first wave of COVID to address the issue of stigma. Do you have any thoughts on that issue, and if anything's changed?
Yeah, I think, the thing is, especially with the COVID, and if it's for 1 month, maybe people might think that it's okay. But the thing is, when this go on and on, the whole year goes by, with lockdown, and the virus is still there. So that really made us really difficult to convince people. And again, in Nepal's case, the first wave was not that contagious. Lucky enough, it was not that contagious. And the people, especially living in rural areas, they started to think that this COVID as such is more like a flu. It's something that will come and go. That really made us really hard. So I think that, there are so many people saying that, even the very high-ranking politician in Nepal saying such thing, giving such statement that, we Nepalese people are immune to COVID, or this is like a flu, it'll come and go. That really makes you hard. So I think that, like the Prahlad sir mentioned, the discipline and ongoing effort to really masking, social distancing, and washing your hands with, these are simple, but it may seem simple when you have to go on a regular basis. Now, region like a Humla, there are so many villages struggling to have soap or masks. Somebody, sometimes they have not been wearing masks for ages. When they are not really used to this or frequent hand washing, then that's a struggle. So I think the effort has been, even in the cities, people are not really disciplined, but in the rural areas, disciplining them, following all those precautions is #1 priority. Remote region, that's I think, until now, that's the only weapon we have to really battle with COVID. But, if this takes another second level, when it becomes really serious, something it comes with, say, if you have to go under ventilator or oxygen concentrator, we are done. Humla, so region, there's no good infrastructure in place, no ventilator. Even if there's a ventilator, you don't have a skilled human resource to really use those things. And there's a hospital, but there's a power shortage. So right now, some of the efforts we're really trying to do is try to get a generators, so that with fuels, so that you can run those oxygen concentrators when somebody gets really serious. So I think all these, there are so many challenges. These are the sort of direct challenges of the COVID. Now, if you think about all the secondary impact, this can, this is really, really hard to cope with.
Yeah, thanks, Angjuk. Dr. Pardal, we had a question from one of our colleagues in Uganda around how Nepal has managed to, or Nepal's experience in managing health workers who test positive for COVID, and how has that impacted their ability to deliver service that's needed. Do you have any advice or thoughts about managing health workers who contract the disease?
Thank you so much. I think the question was regarding health worker. No? Yeah.
Yes.
Yes. Health worker safety has been a great concern in this COVID-19. Since COVID has been, many research are going on, and many data are still to come regarding COVID. Still, we don't know about much detail about COVID. So those healthcare workers who are directly involved in patient care or in public awareness, in those who are in community, they are still worried about their health concern. There is a rumor that those who are infected with COVID, those who work in COVID duties for a long time, they get severe infection. It is quite true. Those who work in ICU, directly contact with patient, the viral load may be increased in those healthcare workers. So they may get severe illness. That is one reason. So that is a concern. So personal protective equipment initially was a problem in Nepal, but I think now the personal protective equipment for healthcare worker is not a major issue. Many helping organizations, donor organizations are helping also. Government is also working strongly on it. Regarding PPE, there is not much problem. And vaccination also, government has already provided vaccination to healthcare worker of Nepal. Some might have been missed, and we WHO are advocating that those health workers who have been missed in previous vaccination schedule should be vaccinated again. So hopefully, those who are remaining to be vaccinated, those healthcare workers will be vaccinated soon. The other allowances, other medical allowances, and other social security scheme which all the healthcare workers should get. They are not being given in Nepal. They were initially government proposed to give extra allowances to healthcare workers, but that has not been implemented yet. Pralasal told that they are keeping nurses in a very cozy places. That is one good example. But there are many healthcare workers who are not been able to go to home freely because of stigma. Society also doesn't accept them properly. They are still struggling. And another problem is that many healthcare workers have small children and elderly parents at their home. So they are finding difficult to adjust also. All healthcare workers are not being provided with that separate isolation hotels or to stay. So that is a thing which should be addressed. On this healthcare worker, PPE has been provided well, vaccination has been given to healthcare worker, and slowly this healthcare quarantine and isolation of those who are actively participating in patient care will be managed soon, and this stigma for regarding healthcare worker will be removed soon. And we have an incident in recent incident Baki that healthcare worker where one patient died in ICU, and that angry patient party went inside ICU, and the physical violence was carried out to healthcare worker. That is a very sad part of our country. We should not have happened. And I hope policy making they will make a strong law regarding protection of healthcare also. Thank you. Over to you.
Thank you, Dr. Sagar. That's really shocking to hear that on top of risking their lives to serve their community, healthcare workers are also facing this stigma and in some cases violence. So very sad to hear that. Prahlad, we had a question come through around who are the most marginalized people throughout the pandemic in Nepal, and kind of where are people suffering the most at the moment?
So I would say, separate two people in a town and people in rural parts. So people in the town, those who are seasonally migrated, or people who are street vendors, or those who are living in rented apartments or rented rooms, actually not apartment. So those people who came to Kathmandu, like those who are migrated to the Kathmandu, and those who are living their life in a daily wages are totally, their life is devastated because they used to make money for the day and feed their kids on that day. So they are the most vulnerable people, and a lot of them also catching lot of them are infected with the COVID. So I think they are the most deprived, or most unlucky people during this pandemic. And if you go to the villages, like, many people, they are now shifted to their own villages from Kathmandu, because the towns were much more affected by the pandemic. So people shifted there. People, went back to their villages, and, they don't have job. And, they lost, many of them, they have lost job and income. And these people are going to villages with the COVID, and lots of villages are, they are transmitting the COVID in the villages. So it's just, the COVID is also, being transmitted, with the movement of the people. So I think, people, low income people in the most remote part of this country are like, they lack basic facility, basic medicines, or if you have to rescue them, if you have to bring them to the oxygen or ICU or ventilators from Umla, you have to have a huge amount of money. Nobody is going to rescue you. Nobody is going to take you to the, ICU or ICU bed or, ventilators. So it's hard. It's hard for the people who are living in a very isolated part of the country, and also the people in a daily wages. They are having hard time.
Can I ask a question about, this has obviously been a really difficult and devastating time, but throughout this, I know personally, watching my colleagues, I've been inspired by everyday acts of bravery and courage, and people really stepping up to serve their community. Has there been a story or an action that's really touched your heart during this pandemic, of people reaching out to help each other, or trying to do their best to support their community? This is for any of you, if you have a story you want to share.
We have lots of stories. I'm on the go.
Oh yeah, absolutely. Yeah, let me actually. It's always the good thing about Nepal is when there's a crisis. I mean, we went through so many crises in our lives. Starting with 10 years of Maoist insurgency, and then devastating 2015 earthquakes, and now this pandemic. So yes, I mean, we Nepalese are really resilient, and when there is crisis, no matter where, in the village or in the cities, I mean, so many, all these, especially younger generations, all these coming coming together to really support each other. So, there are so many stories, and it gives you hope. When everybody's coming together, something like this, you really fear to go out, and and you really care about your family and your children. But when young people and they come out and try to give their helping hands, and so it's just this is something that really gives you hope. And I've been talking about our own working areas, very remote, like Gangfedi, or the Nuakot districts. There's a small Gangfedi that we work in, and a simple story: a very young girl who was really sick. It looks like in the initial, we really didn't know whether it's a COVID or not, but she had all the COVID symptoms, especially in the rural village, not having, struggling with the breathing. So when the Dara and the teacher on the ground and the local government, we jump in right away, rescue her, take her to the nearby isolation center, put her on oxygen concentrator, gave her the treatment, and we could save her life. Every life counts. So something like, there are countless stories out there that people just jump in and supported each other. It's I think, yeah, it's Nepalese people are really strong and really trying to help each other. That's a big hope for all of us.
I think I would add one very short story of our own staff, Resam. It was a lockdown, and after second week of the lockdown, he had all the mental syndrome. He started feeling like he had a high blood pressure, his heart is weak, he needed like a psychosocial counseling. He visited heart doctor actually. So he was all kind of mental symptom at that time, being inside the house. Then all of a sudden we decided to work in the border, and he's the only resource we had. So he was ill for the 2 weeks, and then we thought like, Resam, can you wake up and go to the border, talk to the security personnel, talk to the UNICEF guys, and let's jump into the border, Jamuna border in Nepalganj, and let's try to manage this border, provide masks to everyone coming, hand washing for everyone coming. Let's try to do it. And the first day he got totally healed with his all his illness, and now he's fully fit. So that's I just wanted to tell you the good story. We have lots of sad stories in the COVID. We have lost lots of our close friends in this pandemic, but just wanted to share like how Resam was ill because of lockdown, and Resam is healed because he's now contributing. He's in the border. He's every day coming with the cloth masks, this and that, and he's totally busy till 8:30 in the night. And we're trying to keep him safe, with all the discipline. And I think his story, it's pretty kind of inspiring to me that, he was ill and got up, and now he has a work, he's no more ill.
I love that story, Prahlad. And I think in times like this, it's very easy to circle the pain and the problems. And it just goes to show that power of when you feel like you're contributing to something bigger and you're helping your community and your country, how much that improves the situation for you and for other people. So I think that's a really beautiful story to end on. I have one more question, and then I'm going to hand over to Odette to say goodnight to everybody. And my question for you, for any of you, is really, how can our supporters, how can the amazing people who've been standing by Adara during this time, what can they do to help? Because I'm sure that they are also feeling overwhelmed by the problem and overwhelmed by the situation. But what is the best way that people can support Nepal at this time? Sure.
Yes. Thank you so much, Adragu, for the nice program. And regarding, I think how can partner organization help? I think these are the question. Was this the question? Yes, how can?
How can people help Nepal at this time?
Yeah, exactly. Only I'd like to highlight only one thing. Please, you all are in Australia, in developed country. Many people, you all are in developed country. Please advocate for vaccine equity. The vaccine equity is a big concern. Other thing we can slowly manage. I think we hospital setting we are doing PPE for healthcare worker also, that has been managed, and border also we are trying the best, countries trying best. Please advocate for vaccine equity. Vaccine nationalism with bigger developed country as a very big challenge and problem for low and middle income countries. Bigger and high economic countries should understand that unless COVID ends up in whole world, they are also not safe. No one is safe until COVID ends in Africa, low and middle income countries like Africa, or many countries of Asia like Nepal, India also. So I request everyone to advocate for vaccine equity. The COVAX, there was a system made through COVAX. Vaccine should be distributed through COVAX. I don't know. I think is it fully functional? It is just working justifiably and justified or not? I don't know. I think we should work on it. Also, we should strengthen COVAX system so that every country, every poor country also gets a vaccine. So I would not like to tell so many. I would not request you to go with many lists and request you to help her in many lists, but only one thing: please advocate for vaccine equity for poor countries also. Thank you so much. It may sound quite harsh, but it is reality. Thank you.
Thank you, Dr. Sagar. We could not agree more. I think it's a huge global issue, and no one is safe until we're all safe. And so I agree with you completely that should be a
Maddie, if I may add a bit
yes,
here, I think
please,
beside the vaccines, and I think in the last few weeks, the cases in Nepal and the whole thing came bit down. It's also because the outpouring support we're receiving from the world, all over the world, everybody is supporting Nepal with oxygen concentrators, oxygen cylinders, so setting up oxygen plants, so all these PPE. So I think the whole world has been so generous for Nepal, and this really helped Nepal government to stabilize the situation. So I think this is wonderful. Not just Nepalese are being supportive, but resilient, all this, but also the outpouring support that we received really help us to get through this one. So really thank you for that.
Thank you, Angjuk. Yes, people are incredibly generous. On that note, I'm going to just extend my huge thanks to all of our panelists and hand over to the wonderful Odette, our amazing founder and chair, for the final word.
Thanks, Maddie, and beautifully chaired. And there's one thing that I've loved, the theme that's come through, not only, you know, the complexity and the size of the existential crisis that our world face and that this beautiful country and these people we love face, but also how good giving is for you and how much hope there is. At Nadara, we profoundly believe that every person, no matter where they're born, is entitled to the same level of service delivery and health and education, entitled to great service delivery. And we will continue to stand every day, as so many people around the world do, to make sure that our neighbours in faraway places have the kind of access that they deserve. We know we can beat COVID. We know we can change the world, and I have to say, you see the incredible leadership that's coming from Nepal. I want to thank you so much, Dr. Sagar, Angjuk and Prahlad. I'm so proud to stand with you as colleagues and all our Nepali team. Our Uganda team also, I know we can see that we have colleagues from Uganda and friends from Uganda here too. We are also experiencing something similar there, and we are standing with you every step of the way. For all those wonderful people on this call, thank you for all these amazing questions. If we haven't got to them, or please do contact us. If you want to find out more about our work, please go on our website, which is www.adaragroup.org. There's tons of information there, and we're always looking for people to stand up and stand with us. This is a very hard time in our world. We are going to solve these problems together as one world, and we're going to be a better world because of it. So let me end with gratitude to all our amazing speakers, to all of you who've listened to this call, who are standing up and supporting the beautiful people of Nepal and our other neighbours in faraway places. We have a lot of work to do. So thank you, everybody. And thanks for joining Adara's webinar.